In this video, we are going to discuss regarding ascending tract, spinal cord to the brain. So there is ascending means sensory tract, sensory pathways. So it is divided as dorsal column. In the previous video, we have discussed regarding what is a dorsal column, what is anterolateral pathway, anterolateral column, or anterior or lateral column, white column. So there is a dorsal column, medial lemniscus pathway, medial lemniscal pathway. Otherwise classified as anterolateral pathway. Then there is some other somatosensory pathway, other somatosensory pathway. Moving on the dorsal column, medial lemniscal pathway, there is two type of the fibers from the upper limb and lower limb, or from the lower portion of the body. There is fasciculus, gracilis, and from the upper part of the body, like upper limb, trunk. So there is fasciculus, cuneatus, and when we can draw, if we draw the image for this is a rough diagram of a spinal cord in the transverse lesion. Anterior, this is posterior, anterior, and we can draw like in this region. In the posterior, we divided into portion. In this region, these are the fasciculus, gracilis, and these are cuneatus. Now moving on the anterolateral, there is a lot of fibers in the anterolateral. So we discuss regarding, there is anterior, spinothalamic, and in the previous video we have discussed regarding what is the spinothalamic. That means the spinal cord to the thalamus. Then another one is lateral, anterior, then lateral, spinothalamic tract, then spinoreticular tract, then spinotactal, and then these are my mesencephalic, then last one is the hypothalamic. These are some anterolateral pathway. Then the other somatosensory are spinocerebellar, spine to the cerebellum, then cuneo-cerebellar, upper limb to the cerebellum, then spino-olivary, olivary through the spine to the olivary nucleus, these tracts. So regarding the anterolateral pathways, in the drawing image we can look in the posterior or lateral side. Let me try to make this other color. This is called posterior spinocerebellar bellar. Then moving on, antero. In this portion, this is the antero spinocerebellar tract. Then moving more anterior, in this region, this is the anterior spinothalamic tract, and after that in the lateral and mid-lateral anterior, in between the gray matter and the anterior spinothalamic tract, there is lateral spinothalamic tract. These are the some major tract, and this is known as dorsal column or medial lemniscus tract. Dorsal column or medial lemniscus portion. We can look in this image. This is the fasciculus gracilis, fasciculus cuneatus, and then posterolateral tract is coming here, and this is posterior spinal. This is the posterior spinocerebellar, then the lateral spinocerebellar, and then the anterior spinocerebellar, and this is lateral spinothalamic, and anterior, this is the spino-olivary, and this is the anterior spinothalamic tract, and these all are the sensory or ascending. Moving on, dorsal column. So if I draw, this is cerebrum, midbrain, pons, medulla, and the spinal cord. And in the spinal cord, from the lower portion of the body, there is a fasciculus gracilis is going on, and from the upper part of the body, fasciculus cuneatus going on, going to the medulla, and there is the nucleus in the medulla. In the medulla there is nucleus for this gracilis and cuneatus. After that, from this nucleus, it passes through the opposite side of the orbiciped and go to the thalamus, and in the thalamus there is a nucleus. Nucleus is ventral posteral nucleus in the thalamus, and after that the fiber goes in the cortex, in the area primary somatosensory. We have the cerebral cortex. This is regarding dorsal column, medial lemniscus, and here this, after discussion, this is forming the medial lemniscus. lemniscus, and these fiber are fasciculus, gracilis, gracile, and cuneatus. This is regarding. You can look also in this image, and it is the sensitive for the touch receptor and the proprioceptive receptors. So going and in the medulla there is a nucleus. After the nucleus, it passes through the another side of the body contralaterally and go in the thalamus. And after the thalamus, it go in the sensory cortex area. Now moving on the anterolateral. Anterolateral sensory cortex, sensory pathways. In this, there are, like in the spinal cord, from the lower limb, touch or pain. So, pain temperature from the upper and lower. This at the level of passing and going the opposite side, and from this is a spinal cord at the two level. From this is from hand, and this is from the leg. Next, fiber coming and keeping in the nucleus, and this is passing through the opposite side. Same is going here, passing through the opposite side and going upward in the higher center, going upward, and at the level of medulla oblongata, it gives some fiber. So this fiber forming the spinal tract, spino-reticular tract, reticular tract, and this fiber going upward, and it's from lateral. These are the lateral division of anterolateral pathway. Anterolateral division of anterolateral pathway. Lateral pathway. And when we more discuss, and after that, this fiber go into the hypothalamus, and the thalamus there is a nuclei, interlaminar nuclei, area of the interlaminar nuclei, intralaminar nuclei of the thalamus, and after that go in the, as a third nuclei, in the cortex. Moving in another pathway. For the lateral spinothalamic tract, lateral spinothalamic tract. This is pons region, and we divide is other levels, like from the spine level to the pons and medulla, and then there is midbrain level, and then in the thalamus region, after that in the cortex, Okay. This is the cortex region, cortex level. So moving on, when there is a spinal, it's coming and passing through the opposite side. This is passing through the opposite side as a lateral spinothalamic tract, lateral spinothalamic tract. And in this there is the like one is for the fast and another is, this is another one is the slow pain. This is for slow pain, and this is for the fast pain. So moving on, in the medulla, bones and medulla, it gives some fibers and formationally help to the reticular formation, and it gives the reticular formation. It's known as spinal reticular. Now this fiber is moving on upward in the midbrain and give to the fibers for tectum, or also fiber give for the periaqueductal gray region. This is known as spinotectal. For giving the tectal, this is spinotectal tract. Now moving on for upward in the thalamus region, it's give to the nucleus for the ventro-posterolateral nucleus, posterolateral nucleus, VPL. So after that go the fiber in the cortex region. But these slow pain fibers, or these fiber are known as neo spinothalamic tract. So it's for slow. For the fast pain there is neo. For the slow pain there is pilospinothalamic tract, and HCMS go upward and giving fibers, go upward and giving fibers. And in the thalamus it's have a nucleus known as, the nucleus name is, in the midline there is the intralaminar nuclei in the thalamus, and after that go the fibers in the cortex. This is regarding laterospinothalamic tract and spinal tract and spinotectal tract. Moving on spinocerebellar tract. We are moving on the spinocerebellar tract. Spine to the cerebellum, cerebellar tract, spinocerebellar tracts. There is some tracts like for spinocerebellar tract. This is higher center, midbrain, then bones, medulla, the spinal cord, and beside that there is the cerebellum. This is the cerebellum from midbrain to the superior corniculum, superior cerebellum peduncles, and then pons, middle cerebral peduncles, and from the medulla there is inferior. Moving on, there is some unconscious joint and the sense that are the anterospinal cerebral tract, like this is going on, and it passes from the opposite side of the contralateral side and going upward at the level of the midbrain, and passes through the midbrain and giving some fiber to the cerebellum and go in the opposite side of the where from the same side of the body, like the sensory information going from the left side of the body to the left side of the cerebellum. By the passing, it passes through the contralateral side through the spinal cord and going upward and at the level of the midbrain, and after that they enter in the cerebellum of the opposite side of the contralateral side of the body, and it's go in the same side of the body where the from the sensory information come. After that there is another some fiber coming and going in the contralateral same side ipsilateral and going upward and going upward and from the superior cerebral peduncle it passes and gives supply to the cerebellum, and another in from the ipsilateral from the same side, the fiber going on, and these fibers penetrate from the inferior cerebral peduncle to the cerebellum. These fibers names are, these two are known as combined anterior spinocerebellar tract in the lateral white column in the medulla. Then this individual tract is known as posterior spinal tract, posterior spinocerebellar tract in the posterolateral white column. In posterolateral white column we have already discussed. Moving on, cuneo-cerebral. In the cuneo-cerebral from the upper limb, these fibers coming and go a nucleus known as cuneo, accessory cuneonucleus in the medulla. This is the nucleus. The fiber coming from the upper limb, mainly for upper limb, coming and going upward in the ipsilaterally, going upward in the ipsilateral, and it's go bind with this nucleus. This nucleus name is cuneate nucleus, and from that it's go in the cerebellum through the inferior peduncle, and this is known as cuneo-cerebral. This pathway is known as cuneo. This tract is known as cuneo-cerebellar tract. These are the some tract. So discuss on the function of the tracts. So we need to discuss briefly, like pain, temperature, sensation, and crude touch. Crude touch are passes through the or by the go in the upper ascend by the lateral and the anterior spinothalamic tract tract. But fine touch and conscious proprioceptive sensations by the pass by the fasciculus gracilis, fasciculus gracili, and fasciculus cuneatus, and unconscious proprioceptives and muscular coordination. It's go in the spinal cord to the cerebellum through the anterior and posterior spinal cerebellum and posterior spinal cerebellar tract. So this is regarding the ascending tracts. So we have discussed almost many things in this revision.